So, welcome everyone. Thank you for joining us tonight for our Not Eligible for PDD Now What online series. We took a little break in August and we're back to bringing weekly sessions every Wednesday from 7 to 9 on different topics. So this week we have the Primary Care Network, Edmonton Oliver. So it's the transitions to adults living with autism. And we have Anisha Doni, who is going to be sharing a little bit about their program. Again, I ask for us to go through the PowerPoint first, and then we'll ask questions at the end. So take it away, Anisha.
Thank you. So good evening, everyone, and welcome. Thank you to Gateway for having me here today. As mentioned, my name is Anisha, and I am a registered social worker and currently working as a mental health navigator at the Edmonton Oliver Primary Care Network. So at the Oliver PCN, we have 3 mental health navigators that are part of our mental health team. The mental health navigators are the first point of contact with patients referred to the mental health team. And we do intake over the phone with every patient to determine eligibility for services. So this discussion often explores services such as income support, disability services, community mental health services, and determining the best route for directing patients to PCN services such as group or individual therapy. We also coordinate partnerships with various community agencies as part of the many projects that run through the PCN. And so one of these projects is the Transitions Adults Living with Autism program that I'm going to be talking about in more detail in this presentation. So in the presentation, I will be kind of providing a brief overview of what a primary care network is, what services can be provided to patients to create a medical model home, and what that looks like in the context of adults living with autism. So what is a primary care network? A primary care network is essentially just a network of doctors and other health providers such as nurses, dietitians, psychologists, social workers, and pharmacists that are working together to provide primary health care to patients. A primary care network can be comprised of one clinic with many physicians and support staff, or several doctors in several clinics in a geographic area. And the Alberta government provides supplementary funding to hire other health professionals to help deliver enhanced services to their patients. Each network has the flexibility to develop programs and to provide services in a way that works locally to meet the needs of the specific patients. Primary care networks are reducing the use of emergency rooms and wait times through extended and after-hour service, providing comprehensive patient education, and optimizing the skills of clinical care teams through outreach programs. So at this time, there are about 41 PCNs in Alberta and 9 in the Edmonton zone. Close to about 3.6 million patients are enrolled and over 1,000 other healthcare professionals are involved. The primary goals of a PCN is to increase the proportion of Albertans with ready access to primary care, managing access to appropriate round-the-clock primary care services, increasing the emphasis on health promotion, disease and injury prevention, and care of patients with complex problems and chronic disease, improving the coordination of primary care with hospital, long-term and specialty care, and facilitating the greater use of multidisciplinary teams in primary health care. So PCNs are laying the groundwork for every Albertan to have a medical or health home that's anchored by a physician with the support of a broader healthcare team for improved access, increased services, and ultimately better care. The work undertaken is designed around the College of Family Physicians of Canada's model for a patient-centered medical home. This work is supported by several Alberta Medical Association-led initiatives that are helping PCNs on their journey to create medical homes for patients across the province. The patient-centered medical home is a care delivery model whereby patient treatment is coordinated through their primary care physician to ensure that they receive the necessary care when and where they need it in a manner that they can understand. The objective is to have a centralized setting that facilitates partnerships between individual patients and their personal physicians, and when appropriate, the patient's family. Care is facilitated by registries, information technology, health information exchange, and other means to assure that patients get the indicated care when and where they need it and want it in a culturally and linguistically appropriate manner. A medical home is where patients feel most comfortable coming for their health needs and guided in their health management plans. The benefits of patients seeing a specific family doctor or practice has been proven to enhance satisfaction as well as access to care. And the key to this model is that it is patient-centered. Each patient that has a family physician that belongs to a primary care network can access services through that particular network. So here are a few of the services that our PCN, the Oliver PCN, provides to patients within our network. So we have chronic disease management nurses. So they help patients manage chronic conditions through individualized support and group classes. We have kinesiologists and exercise specialists. So they support lifelong physical activity through counseling and education, training and classes. We also have dietitians who provide nutrition and diet counseling to help patients manage chronic diseases or other dietary restrictions. We have pharmacists who can complete medication reviews, offer smoking cessation classes, and help patients understand their medications. We have mental health coordinators that provide support, counseling services, classes, and referrals to community services. Some of the mental health services that we provide is individual counseling, either through a mental health clinician or psychologist. We have mental health navigation and group classes. We also have referral coordinators that streamline patient referrals to internal and external healthcare providers and specialists, and screening coordinators that work with the family physicians to remind patients about important screening tests and health exams. So I'm going to talk a little bit about what autism is. I'm not going to go into a lot of details, as I'm sure most of you already know all of this. So I have a definition here that we got from Autism Speaks. So autism and autism spectrum disorder are both general terms for a group of complex disorders of brain development. These disorders are characterized in varying degrees by difficulties in social interaction, verbal and nonverbal communication, and repetitive behaviors. So ASD has no physical identifying characteristics. It can sometimes be considered an invisible disability. You may not know that someone has ASD until they choose to disclose that to you. Sometimes the developmental delays in childhood shrink or disappear as they get older. Now, this doesn't mean that the person stops having ASD or grows out of it. It just means that the behaviors or symptoms may change over time. One contributor to this change could be environmental factors. It is a lifelong condition that impacts not only the person with ASD, but their families, their caregivers, and communities. Each person with ASD is unique and will have different symptoms, deficits, and abilities, and the need for support can range from substantial to none. Prevalence of ASD, so 1 in 66 in children. This statistic does not reflect adults diagnosed with ASD, so this is because some adults were not diagnosed as children and were diagnosed later in life. The prevalence of ASD has increased over 100% in the last 10 years. ASD is now the fastest growing and most commonly diagnosed neurological disorder in Canada. And this prevalence is due to other factors, one being just more awareness of ASD, also access to public funding for getting a diagnosis. Another factor is a change in the DSM in 1994 that broadened the criteria for a diagnosis of ASD. Also in 2013, the diagnosis of Asperger's was taken out and included to be part of the ASD diagnosis. It's more common in males, 4 to 1. 50% have an IQ in normal range, keeping in mind that IQ is not always reflective of someone's ability. So for example, a person may have a very high IQ, but lack social skills, or the opposite of that. It is more common in people with certain genetic or chromosomal conditions. Autism occurs in all racial, ethnic, and socioeconomic groups. Mental health concerns such as anxiety and depression are common in individuals with ASD. And with the right supports, all individuals with ASD can thrive. So moving on now to the transitions program and how this all started. In the Edmonton zone, approximately 250 individuals are joining the population of adults with ASD each year. The lack of coordinated autism knowledgeable health and mental health care for the rapidly growing number of adults with autism in Alberta is a critical issue. When children become adults, they're often expected to navigate through life with little or no support. This is especially difficult for many adults living with autism spectrum disorder. And the lack of autism-friendly care available leaves many struggling to connect in their communities. So to help fill this gap, we've created a much-needed service for adults with ASD in partnership with the Glenrose Rehabilitation Hospital, the City Family Foundation, and other agencies in the community. So in 2013-2014, with funding from the City Family Foundation, the Glenrose Hospital investigated gaps in medical service for adults with ASD in the Greater Edmonton region and best practice approaches for addressing those gaps. So the Glenrose Hospital approached us to see if we would be interested in partnering with them and Autism Alberta, Autism Edmonton on working on a program to attach adults living with autism to a family physician or to specialty psychiatry care. The advisory committee was composed of parents of adults that have ASD, adults with ASD, Autism Edmonton, Autism Alberta, the Glenrose Rehabilitation Hospital, the Edmonton Oliver PCN, and then Alberta Health Services Addictions and Mental Health. In the fall of 2015, after partnering with the Glenrose Hospital to develop a primary care specific program, the Edmonton Oliver PCN initiated an exciting new service for adults with autism spectrum disorder in the Greater Edmonton area. And so three major areas of medical need were identified, one being a diagnostic service for adults suspected of having autism, two, an autism-friendly primary medical care home for adults with ASD, and three, a consultation service to support physicians who have adults with autism in their medical practice. Some of the other needs that were identified is housing, employment, and capacity building. So our goal was to champion a person-centered ASD medical home, and with that intent, we established an autism-friendly primary care medical service for adults with ASD. So following a series of educational sessions, we opened our doors to adults with ASD who did not have a family physician. Our program includes a psychiatrist, Dr. Yogesh Thakur, with training in this area, autism-aware physicians, and a multidisciplinary team who liaise and collaborate within the network. The group of doctors and the health team address basic and complex medical and behavioral issues and provide links to specialists as needed. So in other words, this support includes access to autism-aware family doctors, support services from a caring team, connections to other services within the community, and access to our in-house psychiatrist who has expertise in ASD. So the Edmonton Oliver Primary Care Network partnered in planning the development of a medical home for adults with ASD. With the guidance of the advisory committee and the participation of experts in ASD, a variety of activities were planned to support EOPCN physicians and staff in this initiative. So 4 education sessions were held between November 2015 and February 2016. The initial session involved multiple presenters, including the Glenrose Hospital executive sponsor of the project, specialist physicians, a parent of an adult with ASD, and the clinic coordinator. This session provided a broad overview of the project, a basic understanding of the strengths and challenges of working with adults with ASD, and information about diagnostic and consultation services. So 3 additional lunch hour sessions were held at the EOPCN pilot site and were specifically oriented to the medical aspects of working with adults with ASD. The sessions included Autism 101, or what we know about ASD, comorbidities common with ASD, and psychopharmacology in adults living with ASD. Approximately 40 staff members attended the initial session, and this included physicians, navigators, allied health professionals, and clerical staff. So next, I'm going to go over what this process looks like. So since 2015, we've had about 230 referrals to the transition program. And criteria to enter our program is that the patient has been diagnosed with autism or believes that they may have autism. And then the patient either has a family doctor with our network already or is looking for a new family doctor. And so referrals and inquiries are sent through our mental health intake to a navigator who tracks all intake information and coordinates care and services needed on a case-by-case basis. The referrals we receive come from many sources. This includes the Glenrose Lifespan Clinic, Autism Edmonton, the CHAT program with the Government of Alberta, and any other community agency or self-referral. And so the mental health navigator completes an intake interview with the patient and or caregiver, and a meeting is arranged with the physician, mental health navigator, and patient and caregiver. So what this looks like is going to be different for every patient. The conversation usually involves talking to the patient or caregiver about the situation and finding out more about their story. So we like to get some background information and find out what the family is needing. We also provide information to them about what the transitions program is and what we can help them with. This conversation is always different because the family's needs always vary. So for some patients, they've already received the diagnosis and are connected within the community and are only looking for a family doctor. For other patients, they may be new to the city or suspect that they may be on the spectrum. They're not connected with any resources or have a family doctor. So the crucial part of this is just to let the patient or caregiver tell their story and be heard. The common response we receive from talking with individuals and their families is that they feel that they have been dismissed by health professionals in the past, which is obviously not a great feeling. One of the most fulfilling parts of my job is when I hear a family or individual say that they feel hope again or feel that a weight has been lifted after having met with us. And so when setting the patient up with a family doctor, we can make arrangements for this over the phone or book them an appointment to see us in person. We leave this up to the patient and the family for what works best for them. And once this is arranged, the doctor's office will contact the patient or caregiver to set up a meet and greet with one of the doctors. This gives the patient a chance to start building that relationship with the doctor. The next step is arranging specialty care and referral to internal PCN services or external services. So this includes booking an appointment with our in-house psychiatrist and arranging referrals to the Glenrose Hospital if required. We can also set patients up with other services that our PCN offers. So for example, counseling or access to a dietitian. Lastly, ongoing care and follow-up is provided. We can help patients connect to other resources in the community or apply for other programs. So for example, income support or AISH. We also work closely with employabilities to help patients who are looking for assistance to find employment. One thing that's important to mention is that we're not case managers and we can't attend appointments with the patients. One question I often get from people is, what can you do to help? And what I like to tell people is that I'm here to help with what you need. If it's not something that I can directly help you with, I can usually connect you to a resource that can. Our team is committed to supporting continued growth and connection within the community. So like I touched on a bit in the previous slide, there are many different individuals and families that we work with, and every single person has been different. We thought we would just kind of share a couple of examples, just give you an idea of what this looks like. So the first example is we met with a 57-year-old man who was recently diagnosed with ASD from the Lifespan Clinic at the Glenrose. This man was married, he was working full-time, he had a great employer who let him work on his own. He was fairly new to Edmonton and did not feel that his doctor had enough knowledge of ASD. And he was referred to PCN by the Glenrose to get a new family doctor. So we met with him and his wife, and they were having some relationship difficulties since he had received the diagnosis. So we helped them both get connected with a new family doctor and helped them access individual counseling services. We also helped him to apply for the disability tax credit. Another example is a 24-year-old female who was referred to PCN by Autism Edmonton. She had graduated high school and she had done some post-secondary but did not complete her program. She had a hard time holding down a job and was living with her mother, who was very supportive. She had been diagnosed with ASD at 19 and needed help to apply for AISH and look for work. So we were able to help her get a new family doctor and to see our psychiatrist, Dr. Thacker, who was able to fill out the AISH medical. We also connected her with employabilities, who worked with her to provide her with some job training and get her connected with a part-time job. So I do have a short video to show you that was developed with the Glenrose Hospital. It kind of just provides an overview of our collaboration and brings kind of everything together. I'm not sure if the sound is going to work that well, so I'll try it out. If you can't hear it, there's not really much that I can do, but it's only about 3 or 4 minutes long, so I'll give it a shot and hopefully you guys can hear it. Let me put that up.
Nikki, there you are. We were looking for you. Nicholas. How did you know where you were? Remember,
Nisha, it
Yeah.
seems like it is quiet. I did get a request to turn up the volume. I'm not sure if everyone can hear. Yeah. Or people
Well, we
sometimes
can.
can't hear.
Okay. Well, we can just skip it then. I don't have a way to put the volume up. I'm sorry about that.
No worries.
So I'll just go on then. Okay. So I was just going to talk a little bit about the patient experience. So most of the patients who were referred to the medical home for adults living with ASD were male, with a median age of 22 years old and a range from 7 to 58 years old. A patient experience survey was used to gather information about the medical home services provided to them by the PCN. 13 responses were received at a response rate of 35%. 5-point scale questions were used, ranging from 1, not at all, to 5, very. And we found overall the patients have had a good experience with the clinic, the staff that they interact with, and then the care that they are receiving. One exception is that the patient's confidence in taking care of their own health is still relatively low. And so we consider this to be an area for improvement. So where do we go from here? So to start, we're trying to create a variety of ways of accessing information, including video and print, as well as trying to create education sessions. So we're working with the Glen Rose Hospital to develop online education for physicians using the Extension for Community Healthcare Outcomes model, and to ensure continuing medical education credits are available to physicians for completing training or attending sessions. This would create an additional incentive to physicians to attend and therefore result in more autism-aware physicians. We are working with the Glen Rose to develop a toolkit for family physicians within our network to spread to the zone and provincially. And the goal is that this toolkit will contain different resources that would be helpful in making physicians more autism aware. We are also looking into expanding this program to other PCNs across Edmonton and Alberta in order to provide more individuals access to care. So you may be transitioning from your pediatrician or family physician, need a diagnosis, or you're just trying to find an autism-friendly physician. Whatever the reason, we can help. If you are already with the Oliver PCN, you can talk to your family doctor who can send in a referral and we'll get in contact with you. But you don't need to have a doctor's referral to be part of transitions. You can do a self-referral and register with us just by contacting us. And if you are just in general looking for a family physician, you can go on to the Alberta Find a Doctor website. It's updated quarterly to accurately reflect physicians who are accepting patients. So this is not specific to autism, but just in general, any doctors who are accepting patients, you can go on to that website there. And then this next slide, I just have my contact information as well as the other navigators and our clinical manager. So we do have time for questions now, but if you do have anything else and you wanted to reach out, feel free to get in contact and we can do what we can to help you. So I'll leave it there, and if there are any questions, feel free.
If you don't want to unmute your microphone, you can always write in the chat. So I can start with a question. I'm just wondering, because you mentioned you have 9 clinics throughout Edmonton. So if somebody comes from the surrounding areas to look for a doctor, where do you send them?
So the 9 clinics that we're talking about are actually the 9 primary care networks. So we're the Oliver Primary Care Network, and then there's like South, North, West, Spruce Grove, Sherwood Park. So right now, unfortunately, we're the only primary care network that has this transitions program. So we can only refer to doctors that are part of our network. So unfortunately, if someone does live in Spruce Grove or Sherwood Park, they would have to come to Edmonton to see the family doctor. We don't have any doctors in those areas because they're not signed with our primary care network. So that is something that we're looking at, hopefully expanding to be all of the primary care networks, just so that it's not in our one area, but it's just kind of a work in progress right now. So I do have families that I work with that are living kind of outside, but they are okay to go through transportation and come to see us in Edmonton. But yeah, unfortunately, we don't have any, we can't really speak to the doctors that are there. I'm sure there are doctors that are there, they're just not part of our primary care network.
Perfect, thank you. And I see the question in the chat, what resources are there for people who live outside of oh, I guess you did answer it. I guess, what other resources can people access?
So, I mean, if they're looking for a doctor, sometimes it is just kind of trial and error. So you would have to like connect, you can find out which doctors are accepting patients in the area that you're in by using the Alberta Find a Doctor website. But because I mean, the thing with autism that I say, it's not, doctors don't need to be specialists in it. They don't need to know everything about autism. They really just need to be patient doctors who are willing to work with the patients, who are willing to be a bit flexible, and just maybe take a little bit of extra time that it sometimes takes. So there definitely are other doctors that are not part of our PCN that are like that. It's just, unfortunately, sometimes it is just trial and error. So usually when you're deciding to get a new family doctor, you can contact that clinic, and if that doctor is accepting patients, you can book what's called a meet and greet with the doctor. So this would be, you don't have to commit to anything. It is just an initial appointment that you're meeting with the doctor, and you can kind of see if that's going to be a good fit. But yeah, that's all that I can really recommend right now in terms of looking for something outside of the doctors that are part of all of our PCN, just because the doctors choose which primary care network they want to belong to, so we can't have all the doctors. But it is something that we're working on, because we obviously, people with autism are everywhere and not just in our little area. And I can't see the chat box, so you'll have to tell me what questions are there.
Yes, no problem. There's another question. Are you accepting new patients at this time?
Yeah, we do have a couple of doctors right now that are accepting new patients. They are both kind of on the north side. But if that's something that you're looking for or that you want to talk about further, we don't need a referral or anything. You can really just call me, and I have my contact information there. You can send me an email or give me a call, and we can talk about it.
Great. How do psychiatrists evaluate a patient with ASD if they don't speak?
So what was that last part? If they don't
speak, if they're nonverbal.
So our psychiatrists will usually, most of the individuals that we've worked with who are nonverbal have a caregiver or support worker, somebody who's with them. So there's questions and things like that that are asked to the caregiver or the support person, and there's just some other ways that they can try to communicate with the individual. But I don't sit in on those psychiatry appointments, so I can't tell you exactly, but we definitely do have some patients that are nonverbal, but usually I'm talking to the parents. We'll meet with the individual, but the questions and stuff are usually going to the caregiver or the support worker.
Perfect, thanks. You mentioned some after-hours services and outreach programs. Can you talk a little bit about those?
So some of those services are not specifically to autism. That's just generally within primary care network. So with after hours, they pretty much just mean we have like evening hours that we provide for our primary care network for our different services. And then the outreach programs are just working with different agencies. So for example, even getting started with this transition program, it's working with the Glenwest Hospital, working with just different things, but it's not specific to autism. It's just in general within our PCN, or all the PCNs actually do it.
So yes, somebody who comes to you and may look for other supports, where else would you refer them?
So it really depends on what kind of supports they're looking for, but we do refer a lot to Autism Edmonton to connect with them if we're not able to provide them with something. And we can kind of be a bit creative and think of other options depending on the person's specific situation. But if they're looking specifically for autism supports, it's usually Autism Edmonton that we're referring them to.
Another question in the chat. What kind of general mental health support do you offer through the Edmonton Oliver PCN?
So we have what we consider short-term goal-based counseling. So we can offer free counseling services with a referral from a doctor. And what that looks like is about 6 sessions that we provide. So we have that's for one-on-one. We also run some different groups and classes. Right now, with everything that's happening, we've moved a lot of our groups online, and we've had some recordings available online of some of our classes. We're not doing anything in person right now, but if you do go to our website, which is just eopcn.ca, we do have all the information there, and they have the classes you can register for. And you don't, for the classes and the recordings, most of them you don't need a referral from a doctor. You can actually just register right online. And there's also, besides mental health, there's dietitian and kinesiologist groups and stuff as well that they've put online there. And then we also have psychiatrists other than our psychiatrist specifically for autism. So for people that are just needing a general psychiatrist, that can be arranged as well with a referral from a doctor.
Great. Are there any other questions? So you mentioned earlier that the doctor and psychiatrists are in different offices.
Yeah.
So you want to
explain that?
Yeah, just share a little more about it.
Yeah, so how it works is the doctors or the GPs work out of their own clinics. So wherever their clinic happens to be, that could be central, north, wherever, that's where the patient would be seeing the family doctor. If they're coming in to see me or they're coming in to see the psychiatrist, we have our location, which is in the Mira Health Center, and that's our building, the primary care network. And so when they're coming in to see the psychiatrist or me, or if they're coming in for counseling or the dietitian services, they're coming into our primary care network. When they're going to see their family doctor, they're actually going to the family doctor's clinic.
Okay. So there aren't doctors that work out of your clinic?
Not the family doctors. So we just have the specialists, the psychiatrists that work out of our, because we're technically a clinic, but we're the primary care network. And then we have, I think, over 150 doctors that are signed with us. And so they all work out of their own clinics throughout the city.
Thank you. And you said that there's a few doctors that have experience with autism, have a lot of patients that support who are on the spectrum. How many would you say are in Edmonton?
I wouldn't be able to say how many are in Edmonton currently right now that are with our primary care network. We have, I think, 3 doctors that are accepting patients right now. That number changes because eventually the doctors panel will get full, and they sometimes won't be able to accept new patients, or sometimes we have new doctors who sign on with our primary care network who have an interest in autism, so we can get different doctors. So that number kind of changes. Right now, though, we have about 2 or 3 that are accepting patients for this specific transitions program.
Great. Any other questions? I have a ton.
And like I said, if something does come up, you can always email me or call me as well. And I can always do my best to answer them as well.
I'll just ask you, because you did talk about supports that you offer to fill out paperwork, like AISH. And there are some who apply for AISH who are on the spectrum and have a hard time actually getting AISH, and they'll have to appeal. So how do you support them to ensure that they are approved?
Yeah, so I mean, when I'm working with a patient or their family, I kind of let them know that, like, I can't guarantee whether they're going to get approved, but enough about the program as to what it needs to have or what documents they have. But I also let people know that a lot of people, unfortunately, get denied AISH the first time. And when you're getting denied, they still give you a year to review that and to submit additional documents. You don't necessarily have to go through an appeal. If we do get that denial, then we can look at what the reasons were and see what we can do to help get better supporting documentation and usually submit those without having to even go through, like I've never had to actually go through an appeal with any of my families. We have been able to just provide the additional documents. It helps that we have the doctors, we have a good relationship with the doctors, so they're usually pretty open to us, like letting them know what we need. And with having Dr. Thacker, our psychiatrist, he knows a lot about what the medicals need to state for AISH, and he's very open to filling those things out. So we're lucky in that regard, but that program is hard. Whether you have autism or not, it is hard. I kind of just tell people, we just take it one step at a time. And if that denial happens, it happens, and then we'll work on the next steps after that.
Great. And what other paperwork do you support with? You mentioned this, but I just want to make sure I got it all.
Yeah, I don't really have like a list necessarily. I really just kind of do it on a case-by-case basis, depending on what the patient is needing. Done income support, AISH, disability tax credit, CPP disability. I've had to have people fill out like medicals for driver's license, different things. So I don't really have like an exhaustive list. It kind of just depends on what comes up. And then I do what I can.
Great. So there's another question in the chat. Would it be possible to mention who the doctors are and where they are located?
Yeah, I will have to pull it up, but if you give me a second, I just don't remember the names. And for these doctors, like if you were interested in it, it's not something that you would necessarily just call the clinic yourself. You would want to go through me just because we have a special process. So they might not know what you're talking about if you don't go through me. But yeah, I can definitely give you the names of the clinics. Okay, so the one clinic is called Medicine Place Walking Clinic, and it's on 5809 118th Ave. Also, just keeping in mind that these change all the time, so this literally could change in a week.
Can you say the address again, sorry?
Yep. 5809 118th Ave.
Okay.
And then the other one is Riverview Medical Center. And then the other one is North Edmonton Medical Clinic. They are on 15345 97th Street. Oh, I don't think I gave you the address for Riverview.
No.
Sorry.
Yeah.
It is 3210 118th Ave.
118th Ave?
And if you want, I don't have like the names of the doctors in front of me right now, but I can always email that to you if you were putting it up somewhere.
That would be great. Do you have pamphlets that you share, we can share with this group?
We do have a brochure, but it doesn't list the doctors just because just all the time, so we don't have that.
No worries.
But we
Just
do
any general information that I can share.
Yeah, I can send that to you. I can send you our brochure and our contact information that you can share as well.
Great. Any other questions? Are there any costs to your supports that you help with paperwork, or is there a cost associated with it?
There's no cost like for what I do or even like if Dr. Thacker is filling out medicals and stuff, there's usually no cost. But the doctors, like the GPs themselves, can charge for medical. That's up to them. Unfortunately, the doctors just sign with us. We don't have any control of how they do their business, so I can't control that part of it, unfortunately, for the medical part. I mean, there are different things, like if someone is on income support, the AISH medical is covered. They can bill for CPP disability. There's different things like that. And Dr. Thacker is usually pretty good. He doesn't usually charge at all for any of the medicals. But yeah, unfortunately, I can't control if the family doctor will.
Mm-hmm. No, totally fair. Would you be doing anything online, any group sessions online for your mental health supports, starting that up just through COVID? And
yeah, it's not autism specific, but we do have some mental health classes, like workshops that we used to run in person that we have recorded that are online, and anyone can go onto our website and register for it and watch the recordings. There's just different topics: coping with anger, workplace stress, effective communication, but they aren't geared toward autism. They are just more general. And then we also run like a grief group and a mindfulness group that's actually like a live group that we run. For both of those, though, you do need to have a referral from one of our doctors, and there is a wait list for it, but we are running it online right now until we go back to in person. So if you do go on our website, we do have a lot of the information. We try to keep it up to date on there. And I know there is from the other disciplines as well, dietitians and kinesiologists, they have stuff available online as well.
great. Are you planning on opening up anytime soon with restrictions?
Technically, we are open right now with restrictions. So we are doing in-person like one-on-one services, but it's just limited. We have a minimum number of patients that we can see a day and limited staff. So we are, and it's not just something you can come in for, it would be like an appointment. So, you know, if someone was wanting to come in to see me, that could definitely be arranged. It would just be waiting. It wouldn't be as easy as it used to be because it would be depending on availability and the days that I would be in the office, but we are technically open and running, just at a lot lower number than we were. Most of our services, or counseling services and things like that, have all been completely virtual. So we haven't really stopped providing any services. It's just changed from in-person to virtual.
Great. Are there any other questions? No. Sandra says, thanks for the information.
Oh, you're welcome.
And I did write, give me one sec. Rowan says, very helpful, thanks. So we have another that says, this is a little off topic, but do you happen to know when the influenza immunization will start this year?
I don't know. Usually I know because we see the nurses in the office and they tell us, but right now we're all working remotely, so I don't interact with people, so I'm not sure yet. I haven't heard about that yet, sorry.
Okay. Probably, hopefully soon.
I feel like I saw something at a pharmacy about it being soon, but I honestly can't remember what it said as to when it was. And I'm not sure, because usually it was something that we were offering through our PCN. I'm not sure what that's going to look like right now with COVID, but give us some information at some point. And usually we put something up on our website as well.
No worries. Well, I was just going to go back to your housing, how you were talking about how you were looking at housing, employment, capacity building. So as you looked at that in 2015 and 2016, the PCN, so where are you now with all those?
So I think we're probably focusing more on the capacity building is what we've been focusing on. So this is in partnership with the Glenrose, who has the funding. Kind of been a bit of a process, but it's kind of our main priority is we do need a lot more doctors because there's definitely a lot more needs. So it's just trying to build that capacity so that the doctors just are more aware and feel more comfortable working with that population. So that's kind of been the main thing right now. We're working very closely with the Glenrose to develop something that we can put out. And it really is just in the works right now. I don't even have a day of when it's going to be done, but it's in the works right now. And the hope is that if we had this training or something available, then we could essentially, doctors could watch this or have this access to these tools. And then it would increase the number of doctors substantially once this like training comes out. So that's kind of what we're focusing on right now.
Great. So it says, Kimberly says, yes, again, thank you. October 19-ish was posted at our pharmacy at Red Deer.
Oh. Okay, so that's probably around then. Thank you.
And then are there any other Edmonton area PCNs looking at offering similar services?
It's not that they're necessarily looking at offering it, but it's something that we're reaching out to them. So we, like our PCN, there's kind of a meetings and stuff like that happen with all of the PCN. So our manager, Tanya, is on that committee. And so she's working on trying to get the other PCNs on board. It's not that simple though. There's a lot of background stuff that has to happen. So it is a work in progress. Like it's something that we're reaching out to the other PCNs about because it would be really helpful to be able to serve the entire city and surrounding area or even province because obviously just our little area is not enough.
Definitely. So in addition to primary care, do you happen to provide referral to oral health care for autistic persons?
Sorry, that was a referral to where?
Oral health care.
I'm not sure what that is, but if it's something that requires like a referral from a GP or something like that, then yeah, our GPs refer to a lot of different things, specialists and things like that. And we have like coordinators that work with our doctors' offices, so they help arrange referrals to anything essentially that people can be referred to. So if it is something that requires a family doctor, then the family doctor should be able to do that.
I'm thinking, Michael, you mean dental dentist.
Oh, dentist?
Mm-hmm.
We don't have, I think Autism Edmonton has on their like toolkit, I think they have a list of some doctors or dentists that are autism friendly, but that's kind of where I refer patients to.
Perfect, thank you. And is there any type of wait list at the moment? If someone contacts you, how long are they waiting?
If someone contacts me, they're usually maybe, it depends on the day. Sometimes I get back to them the same day, sometimes it's 2 days. So it's not usually too long for me to get back to them. In terms of getting set up with the doctor, the wait time isn't too long. Once we do the referral and everything, I'd say within a week or so, they can get in with the doctor. The only thing that there's really a wait time for is to see our psychiatrist. So Dr. Thacker is only with our clinic once a month. and there can be kind of a long wait time for that, depending on, honestly, it depends on how many referrals we get, but sometimes it can be like up to 6 months to see him. Sometimes it can be 2 months. It changes all the time. Right now, because Dr. Thacker also does autism assessments for patients that are connected with our PCN. And for that, there is a bit of a wait time just because he can't do that virtually. So we've had to kind of put a hold on it until we can do in person. So there's a bit of a wait list for that.
Okay.
Even that, I would say probably only like 2 or 3 months for that, which isn't bad. I think the Glenrose has a wait time of over 2 years right now to get an assessment, so it's not as bad, but that will just be dependent on what happens with cases and stuff like that as to whether or not we can offer that in person.
Yes, thanks. That's good to know.
There is also a wait time, like, so for example, if someone was wanting to access our counseling services once they got a referral, we do have a wait time for that. Usually that ranges between like a month to 6 weeks to get an appointment. And that's for counseling.
Perfect. Are there any other questions? If not, if you think of something, wake up in the middle of the night and say you forgot to ask something, you have Anisha's contact number. I left it in the chat, and then the other mental health navigators, their contact information is on the screen there. So yes, if we can wrap up if there are no other questions. And next week, our topic is going to be guardianship and trusteeship. It's such a popular topic. We got it in, we had someone speak about it in May, and so we decided to do another session on guardianship. If you're interested, please sign up on our website. Thank you so much, Anisha.
Oh, you're welcome.
And thanks to everyone for joining us.